So I'm here with Sue, and she's with a very interesting project here in Eugene, Oregon. It's the Occupied Medical Mobile Clinic, and that's what you'll see in the background. Plus, the lead-in with the music is going to have some still pictures. What these folks have is it's an old blood bank bus that was converted to a mobile clinic. I take it the conversion was relatively easy. Were there any other modifications that you really had to do, or was it just a matter of changing its purpose and adding a little bit of equipment?
There's a couple of things that we had to change. They had the big red vinyl benches that you lay on in order to give blood, and we took those out. We already had cabinetry, which was really nice. We had to add a few more cabinetry. And there's more stuff that we do need to do to it. We'll have to have room dividers. Right now we're using curtains, but we just haven't had the resources, either the time, the volunteers. We do have some money set aside for it, but you know, we're all volunteers, and we're trying to kind of get it done in our free time, whatever that means.
Right.
Oh, sorry. Okay.
And so a lot of the volunteers are medical professionals also, so this is kind of a part-time thing with most of the people, right?
Yeah.
And so you mentioned it, the room dividers, and of course in the still pictures we've got the tentage, and I know so you got storage bins under the bus.
Mm-hmm.
You can tell us a little bit about the types of services you provide.
Okay.
Today is Sunday. You're here for several hours at a park on Sunday.
Yeah.
I would guess that time and finances permitting, you'd be able to do it in other places, but probably...
If we could get some paid staff, that would be great, but our current application for being a 501c3 is still with the IRS right now. When they bring it back, then we'll be able to get grants and a few more income sources so we can pay for some more pieces of like AED machine, for example. They're very expensive, and right now we survive on donations that people bring by, which is wonderful. And we're actually able to help. There's a couple of clinics starting overseas that the Rotary Club has been working to set up in Guam and different places like that, and we've been able to be kind of the relay point for people that have contacted us. They have some hospital-worthy items that we don't use in our urgent care, and so we just refer them over there, and that feels really good. But in the meantime, you know, we go through a lot of gauze. We don't carry syringes. We need some herbal medications because that's what people are interested in, and this is patient-centered care. So our point is to help people with what they have already in their life. And for instance, with our Honduran patients, they do not see prescription medication as being anything but part of the enslaver class. So the herbal medication is something they feel comfortable with, and we honor their traditions and offer that to them. People walk off with everything free. It's a healthcare for all model.
Right.
And that's what we'd like if we had universal healthcare.
And so far, there's actually been very little government money on this, almost none, right?
None, yeah.
Yeah, none. This is all private effort that's done this.
Correct, yeah. We do get some support from the city, and that they have donated the use of bucks and a hand washing station, a portable bathroom and a hand washing station.
Right, we saw that up back, yeah.
And they let us come here every Sunday for free. They don't charge us for that. So one of the other things I would like them to do is to put up secured sharps containers in the parks so that people who have diabetic needles, and that's a huge population, unfortunately, and it's growing, that they would have a safe place to put those.
And that is kind of an interesting thing, because one of the things I do on-call handyman work, and I go into a house and we see needles, you know, sometimes there are needles around, and it's not always a heroin addict. And when we look, there was a person there.
B12 shots, for example.
Yeah, insulin shots and diabetic people. It's not always an indicator that, oh my God, there's a heroin addict here.
Right.
There's quite often these people have real medical issues and they're homeless.
Right.
We noticed that in the RV mobile living. It's not a clear, you know. Sometimes they have medical needs, and part of that involves you know, that's just their thing. And And it's not going to be a magnet for crime. I noticed that it's a relatively
No.
peaceful thing.
Actually,
I mean,
quite the opposite. If you can take a needle and put it in a secured place where no one else can get into it, it's for deposit only, that means that's a non-reused needle. So it'll
Right.
actually decrease the amount of crime.
right, yeah, and
Some
it's,
people don't get that.
yeah. Well, I notice there's a lot of things in this town that some people don't get. I would be getting into another issue in another video that somebody else made. But there definitely were people trying to pounce on an opportunity to exercise their prejudice when it just wasn't based on fact. I mean,
Right.
it was based on what they were making up as they went.
Yeah, I
And
think that's one of the things that Occupy Medical does fairly well is offer, because we're such a large item. You know, we're red and white bus, and we're here every Sunday, and we offer a lot of education to the general public. We talk to city council regularly in public. We try to make sure that people know about the health issues. We talk about, you know, in the winter they shut down the water, so we see huge dehydration issues with the unhoused. So if you want to help someone who's unhoused in the winter, give them some water. And people, they open their eyes and go, oh my gosh, I never thought about that. But yeah, you're right. People that have diabetes and if they're dehydrated, their blood sugar goes through the roof. At 600, that's when you lapse into a diabetic coma. A couple of weeks ago, we were seeing regularly people 550 and above. Regularly. Just because they don't have water.
oh, like,
Their blood glucose.
so
their blood
yeah,
gets
because in
thick.
Portland we have the public drinking fountains around. And,
Right,
and of
and
course,
we have it turned off in the
Oh,
winter
they
so the
turned it
pipes don't
off.
freeze. Yeah.
Oh,
so
I
when
see.
we have a dry winter like this winter, unfortunately the unhoused, they don't have places to drink out of. Like before they were drinking out of puddles or collection spots, and there's nowhere for them to, I'm not advocating drinking out of puddles, of course.
Right.
But the other places where snow or rain would collect, they were able to drink out of that. And this winter was so dry, there wasn't even that for them. So
I
that's
see.
why we're seeing so much dehydration. And of course the kidney issues, etc. are escalating.
right, and you can really see that from the front lines.
A lot, yeah.
And as far as opportunities for volunteers, somebody could also probably spend a little time here. I know these things exist in other parts of the country, but probably not that many, or
Not to this degree.
not where
There
somebody's.
are free clinics. There's free clinics, you know,
But the
all over
mobile
place.
thing is, see, that's what I've been trying to advocate with some people, is mobile infrastructure.
Right.
And with mobile infrastructure, you take some of these services that cause people to need to be in the middle of the city. And there's a lot of people there. There's an operation in Portland called Dignity Village. Some of these, or Right to Dream too.
Yep.
I've done volunteer work out there at Dignity Village, but not Right to Dream.
RTD.
And talking to some of the people, they said the reason they really needed to be in a city was that's where the services are.
Yeah.
And if somebody's trying to provide services to the more remote areas, the problem is that the individual locations are always spread apart, so that reduces the amount of time anyone can spend there. You know, if you're going to stop, we can only be here 10 minutes because the next group of people are a half hour down the road.
And here we are, a Sunday clinic. You know, the only options in Eugene for medical care is one urgent care clinic, which is just about 4 or 5 blocks away. And then we have 2 hospitals in Springfield. So that's all we have in Eugene. So that's one of the reasons why we're seeing both the housed and the unhoused. 40% of the people that we see are unhoused, and the rest are housed. They may have insurance, but their premiums are way too high. And also for families that have children, they're not sure if their child has an ear infection or a tooth coming in, or they don't know, and it's easy to come to us and we'll check it out and then make references. Well, actually this child needs to go to a hospital, or no, this is, you know, a doctor has made the diagnosis, it's just a tooth issue, and here's some ways of handling that, and educate the parent on what to look for if there is a danger.
Makes sense.
Yeah.
And so as I get up on time, I got to deal with the attention span of the average YouTube watcher at 10 minutes. You have a website, I understand?
Yes, we do.
And what's that again? Is
Let's see.
I'll find it and I'll put a link. We're going to put a link in the description on that.
Real quick thing about the services that we do offer. Again, like you had mentioned, we're kind of a one-stop shopping in that we offer food, because malnutrition is one of the biggest problems that we combat here with the population that we serve. And we also have hygiene supplies that we give away. We have mental health providers that are here to support people, both religious and non-religious, secular. We have triage team, EMTs, doctor, wound care area. We have a foot care specialist. And one of the reasons why we have the foot care clinic is because people that are unhoused, they have swelling feet, they have to keep on the move all the time. If you stand still, that's considered trespassing. Or if you sit down, that's considered camping, so that's an expensive citation. Trench foot, as well as when it rains, we have frostbite, which is in this area only for the unhoused, because if you're cold and you're housed, obviously you just go inside.
Yeah.
So we also have the nutritionists, we have the herbalists, we have, trying to think of all the other things we have. There's every week it seems like there's something new that we need to add, and new people show up to offer those services. And again, we're all volunteer. We only are here on Sunday from 12 to 4, and we are just delighted to serve, and we will continue doing so. It's been 3 years thus far, and there's no signs of stopping. As a matter of fact, it's bigger than it's ever been.
Yeah. All right. Well, I think we'll be talking again. We're trying to figure out a few things here with the video angle, but I think it'll be good to talk again about this and see if maybe some of my viewers who are in this area might want to do something productive, especially with regard to what you mentioned in the curtain thing. Hopefully somebody will make contact on that.
And there's a lot of small things that people can offer us, as well as I said before, we need an AED machine, and gas is expensive.
Okay.
We would love to have someone come through and check our electrical. It's a big old bus. There's
well, the electrical I can probably work with.
That would be great.
Yeah. All right. Well, I'll post this video. We'll probably post a few more too.
Okay.
And we'll talk in a bit.